You know what? 80% of our immune system lies in our digestive tract.
Okay.
Mercury, hey, you know what? It's been happening for a millennia, and our body's adapted to the environmental ingestion of mercury. Now, it's just recently that we started injecting it into the bloodstream.
Okay,
and
wait,
not just mercury, it's aluminum.
I first want to contradict you about the 80% of our immune system is in our GI tract. That is,
it is.
It is not. That is an absolutely wrong statement. Our immune our immune system is predominantly in our blood system.
That's called the IgG response, not the IgA and the IgE response.
Our immune system, in terms of the bulk of it, is and where it's produced, it's produced in the thymus, it's produced in the spleen. But the point.
And realizing that 70 to 80% of your immune system is in your GI tract, in your bowels.
Thank you very much for saying that. I had a flat out argument with that MD. I said about 80% of your immune system is within the GI tract, and he was flat out denying. I am so glad you said that, doctor, because it makes sense if 90 to 95% of the toxoids, toxins, and pathogens enter through our alimentary tract and our nasopharynx. You're going to have a huge amount of immune system buildup within that GI tract.
Well, that's the result of many centuries of human existence on this planet. That's how we get to be in harmony with our environment, is through the nasopharynx and the GI tract. I mean, you just look at a baby, you typify a baby crawling around on the floor. That baby's putting everything into its mouth.
Right.
Socks and the dog's ear and
dirt.
keys. And dirt, and that's how the child learns to get in harmony with its environment, by getting those fungi and bacteria and viruses and parasites and whatever it's exposed to, and dirt, putting it in its mouth. That's how it learns about the environment. That's how it's been programmed and processed. So until vaccines can approach, having that kind of consistency, meaning natural exposure, you're never going to generate a response by the immune system or the nervous system that comes close to the natural. And you're going to pay for it, and we're paying for it. And the consequences, what they call the hygienic diseases.
Right.
Hygienic diseases are like diabetes and allergies and asthma and autism and Crohn's disease and all that.
Now, we're going to get to the autism question a little bit later, but we're educated in the IgA, the IgE response versus the IgG, which is basically the IgG is basically a blood system response, correct?
Yeah, that's just a protein class that the body makes to defend, to neutralize bacteria and viruses, etc.
Okay, so that's one system. Now, the IgA and the IgE has to do with mucous membranes, and it has to do with the GI tract response, correct?
IgA does, correct. IgE is the one that pretty much, if you have allergies and your allergies are kicking up, that means your IgE levels are up.
Are up, and they're kind of they're kind of annoying, if anything, right? A weak response.
Correct. I mean, there was a design why the body developed that in the first place, primarily to get rid of parasites. But now that we no longer have parasites, the body then, if it's out of balance, will generate that kind of a response to things in the air, your dusts, your danders, your foods, etc. But people who have allergies, that essentially says that your immune system's out of balance.
Now, here's the rub, though. Because we inject it into most all of them, we inject into our bloodstream. Does the IgA response have the most effectiveness when it's injected into the blood?
It pretty much has no effect. I mean, the purpose of the IgA response is to protect you from how you would normally get that microorganism naturally. And there's IgA to help defend you in your respiratory tract, and IgA to defend you in your GI tract.
Yep.
So if you're getting injected with a vaccine, you don't get the IgA effect. So you don't have gut immunity, you don't get respiratory immunity, which is a very important part of the permanent immunity you get from naturally being exposed to those microorganisms.
Exactly. Oh, Dr. Marini. We're talking to Dr. Steve Marini, and he is an immunologist plus a wonderful chiropractor. He spends his time in private practice, correct? And teaching.
Yeah, that's correct.
And you're consulting with the International Chiropractic Pediatric Association, correct?
Correct.
Can you describe
I'm the president of the board there.
Oh, are you? Okay. Would you like to promote the ICPA a little bit? Tell us a little bit about the ICPA.
Well, the ICPA is devoted primarily to the research and education in pediatrics and bringing not only chiropractic health and wellness to the pediatric patient, but to the entire family. And for those who are interested in any pediatric information, breastfeeding, even moms in terms of pregnancy and turning problems, fetal positioning, breastfeeding, allergy issues, nutritional issues, exercise issues, whatever issues you may have regarding your pediatric patient, I recommend you going to the website of the ICPA, which is www.icpa, the number 4, kids, kids.com, and you'll get a plethora of information there.
That the study is, but that's not saying that. So if that is not true, but that is not saying that that the that the there you know